go to the operating room and try to duplicate it. Not always the easiest thing to do. 1954, Dr. Murray transplanted a kidney, and Longacre used dermofat flaps, which he advanced from the abdomen to augment breasts. 1955 is the introduction of Ivolon, plastic sponge. Didn't have much of a life because it compressed. In 1958, there are now 150,000 plastic surgery procedures versus 15,000 in 1948. Dr. Tanzer, a name that I knew, he started the wonderful repair of the microtia, which is one of the most difficult things to this day. 1959, polyester was introduced to replace Ivolon. 1960, first demonstration of lasers, and in 1960, description of microsurgical technique by Jacobson, and look where we've come to now. 1960, Etheron is introduced, used unsuccessfully. The new beginning, particularly in the beginning of my life as a plastic surgeon in 1962, the first silicone breast implant was introduced and used clinically by Dr. Cronin, and we're all familiar with that. Omental flaps were used in breast augmentation, and Dow Corning in 1964 marketed the Cronin breast implant. Turkey gobbler, described in 1964, and that year as well, the first CO2 laser was built. Inflatable breast implants, described by Ariane, and I had the misfortune or the good luck to describe a round silicone implant. And in 1966, I learned something. It was called office surgery. And it was kind of interesting. It's not that people had not done surgery out of the office. Of course they had. But for 20 years, it was quiescent. And when I left the service, I learned how to do it because I was quite good at IV sedation, and I thought, what a wonderful idea. Many of my contemporaries did not think so. 1970, another hero of mine, Dr. Patangi, popularized body sculpting, and it's a great influence on everyone to this day. Beauty was a point.